the Affordable Care Act, it's interesting and I think it illustrates how much this is politics and not policy, is that the Affordable Care Act is really a model that came out of the Heritage Foundation and was passed in Massachusetts in 2006 by Governor Mitt Romney, a Republican, and then was taken up by President Obama as the model for the health legislation that he pushed forward. And so suddenly you see now the Republicans hate it, the Democrats love it. If it had been Mitt Romney that was elected president, we probably would have seen the complete different scenario. Medicaid expansion for those at the lower end of the income spectrum. Everybody else has to purchase private insurance. We use our public dollars to subsidize the purchase of that private insurance. Those dollars go directly into the pockets of the health insurance companies. And then in return, they're supposed to accept more regulation. So saying that they had to cover people with pre-existing conditions, saying that they had to cover certain essential benefits. That was a trade-off by basically not only guaranteeing them customers, but the government actually setting up markets and hiring people to sell their insurance for them. For the next slide. And there's another interesting thing about the Affordable Care Act is it actually codified into law a class-based system or a tiered system. So there were 5 tiers of coverage: platinum, gold, silver, bronze, and then catastrophic. And now they're adding another one. It's being called a copper. And basically, the lower tier plans cover less and have higher out-of-pocket costs. So we had a tiered system before, kind of de facto, but now it's codified into law. And then at the bottom, I wrote narrow and ultra narrow networks because what private insurance companies did is, although we required them to cover people with pre-existing conditions, they just really shrunk down the number of health providers in their networks and also cut out major medical centers. So people with actual health problems may struggle to find a provider in their network. They may struggle to find, if they have cancer, they can't go to the cancer center. That's not covered. They have to pay for it out of pocket. So the insurance companies, they always find a way around the regulations that we give them. Okay, next slide. So the way that I usually talk about the current system is that it's a market-based system. The United States is an outlier for having a market-based system, and we have a market failure. It's the most expensive. I didn't go into it, but our health outcomes are poor compared to other countries. We have increasing health disparities, particularly for, oppressed communities. We have the highest number of preventable deaths of the industrialized nations. We're losing our doctors because of the system. Physician burnout was considered our second greatest problem last year behind opioid addiction. And we have a number of people that are uninsured, but also a lot of people who are underinsured. They have health insurance, but they can't afford to use it. Go to the next slide. Another interesting point that was made about the Affordable Care Act is that it became kind of this new model for social insurance that was considered to be progressive. And so the article, which is cited down at the bottom, there's a quote from it that says, if Obamacare, built on means testing, privatizing, and decentralization to the states, is treated by progressives as the greatest liberal public policy success in the last half century, and how will we be able to argue against proposals by conservative Republicans and center-right neoliberal Democrats to means test, privatize, and decentralize Social Security and Medicare? And that's actually, what we're starting to see. President Obama was pushing Myra. It didn't really go very far, but it was changing Social Security into, investment, a financial tool on Wall Street. We're seeing cuts and changes to Medicare that are driving it to be more privatized.